there, Bailey? Just checking on you now.
My symptoms of menopause began when I was about 51 years of age.
At the beginning, it's a surprise. You don't really realize it because it comes on slowly.
And I went through about probably 10 years of what I know now that are symptoms without knowing or putting the name menopause on it.
The symptoms can be difficult to understand. Most people think of menopause as the time when a woman's menstrual cycle ends. But before menopause or perimenopause, some women experience the worst symptoms without even knowing it.
But I was clueless. I didn't realize when I was perimenopausal the things that were happening to me, the mood swings, and I would get an occasional hot flash, and I didn't know what it was.
Dr. Isaac Schiff from Massachusetts General Hospital helps women understand the changes they are experiencing.
Well, I would like to think of menopause as a natural change in a woman, just like going through puberty is a natural physiologic change. We ought not to think of menopause as an illness.
Menopause is a big adjustment. Sidel Kramer of Pembroke Pines, Florida, remembers struggling to find what would work for her. After speaking with her doctor and confiding in friends, Sidel decided to try alternative medicines.
Well, the doctor gave me choice. He said I could either go on hormone replacement, which at that time was not really what I wanted to do, so I started with homeopathic over-the-counter medications for the hot flashes, because that was my biggest problem. But I found that after a prolonged period of time, I was still losing sleep at night.
After having limited success with alternative medicines, Sidel tried hormone therapy. She was concerned, though, about the risks associated with its use. Combined hormone therapy, which uses estrogen and progestin, may increase the risk for blood clots in the legs and lungs, stroke, and breast cancer.
Cancer does run in my family, so I gave myself a limit. And if it leaves the problem for a year, I'll be happy. And that's the route I went to take.
For some women, especially those with severe hot flashes, the benefits of hormone therapy may outweigh the risks. It helps reduce symptoms such as hot flashes, which may contribute to night sweats and sleeplessness. Menopause is a time for a woman to pay attention to her physical health. But her emotional health is also being affected. Conjeta Manikis remembers how menopause changed her body and her mind.
The difference that I feel was in my relationship. And my spouse felt that I was getting old, saw me as someone who was old. That's why I say it's very important to discuss these things and work them through with your spouse so that they understand what you're going through emotionally and that they can be supportive. If they make jokes and say, "Oh, you're just getting old," it really does crash down on you heavy.
Whether a woman's transition into menopause is easy or tough, she is equally vulnerable to the same risks. Because after menopause, her chances of having heart disease increases. Dr. Deborah Smith, an OB/GYN who's worked for years in the field of women's cardiovascular disease, says it's important to get screening for any risk factors.
Women tend to have a twofold increase in their risk of developing heart disease or heart attack once they go through menopause.
In a small town in Michigan, 56-year-old Dee Adams is revolutionizing the way people view menopause. She's hoping humor will reduce the kind of anxiety it brings to millions of women.
And I was never one to be concerned about, oh, I'm getting older. I mean, when I turned 30, when I turned 40, even when I turned 50, it's no big deal. I accept it, you know, it's inevitable.
Using a simple pencil, pen, and plain white paper, Dee is able to express some of the awkward feelings menopause generates.
Menopause came from out of the blue, and I thought, that's got to be it's a cartoon character name, and there is nothing out there that women my age could relate to in a sense of humor, you know, with a sense of humor. So that's where it started.
With humorous messages and creative outlines, Dee uses Menopause to inspire women to view menopause as a natural event in their lives.
I just knew that she had a voice and that there was nobody else out there talking about it. So I started making fun of the things that I was going through. She's like every woman, she's got all of the symptoms, you know. One person may not have, I may not have, but menopause has it all. So everybody can relate to her.
Menopause is a serious time in a woman's life. Dee's vision is that women will face the challenges with a light heart and an occasional chuckle.
If you don't take it so seriously, you don't worry as much, you don't get depressed, you tackle it, you know, and you feel stronger. I chose humor to get a message across because it's always worked for me.